Today, we're digging into something called sudden hearing loss. And that subtitle, a medical emergency? Yeah, that's not an exaggeration. This is a situation where every single minute really, really counts. Just imagine for a second. You wake up and something's off. The world sounds muffled, maybe on just one side. You grab your phone to make a call, press it to your usual ear, and nothing. Just silence. You panic for a second, switch ears, and bam, you can hear perfectly fine. It's not your phone. And listen, this isn't some hypothetical scenario. For thousands of people every single year, this becomes their reality. It's a real deal medical emergency, and it can happen to literally anyone, often with zero warning. All right, so what is this? What are we actually talking about when we say a sudden silence? Let's get into the specifics. Okay, so the official name is Sudden Sensorineural Hearing Loss, or SSHNL. And here's the clinical definition. It's a super fast loss of at least 30 decibels. Now, what does that even mean? Well, a 30 decibel drop is a huge deal. It's basically the difference between hearing a normal conversation and someone whispering. And the key part is sudden. It can happen in an instant or just over a couple of days. And it's usually not just the hearing loss. A lot of the time, other weird symptoms tag along. You might get a nonstop ringing in your ear. That's tinnitus. Or this weird feeling of pressure, like your ear is clogged. And for some, it gets even worse, with intense dizziness, vertigo, that can make you feel sick to your stomach. Okay, if you remember one thing from all of this, let it be this slide. It is not just a blockage. It's so easy to think, oh, it's probably just earwax, or my sinuses are acting up, it'll pass. But waiting is the absolute worst thing you can do. You have to understand, this is a true medical emergency. So who does this actually happen to? Is there a typical person who gets this? Let's take a look at the data. Get this, 9 times out of 10, it only affects one ear. That's a huge majority. And that's part of what makes it so unsettling, right? Your whole sense of sound is suddenly thrown off balance. And when does it tend to hit? Well, the most common age range is between 30 and 60. So we're talking about people right in the middle of their careers, raising families, just smack in the middle of life. And you might be thinking, this sounds super rare, but check this out. In the US alone, we're looking at about 4,000 new cases every year. If you do the math, that's more than 10 people every single day who suddenly find their world has gone quiet. Okay, this next part is, well, it's honestly one of the most frustrating things about SSNHL. Because for most people who go through this, finding out why it happened is like trying to solve a mystery with no clues. I mean, just let that sink in. For up to 90% of patients, doctors have no idea what caused it. They can't find a single definitive reason. You walk into the doctor's office, and the biggest question, why me? Why now? Is just a giant question mark. There's a medical term for this, and you'll hear it a lot, idiopathic. It sounds fancy, but it's basically the official way of saying, we don't know why it happened. And that's a huge reason why more research on this is so important. And a big reason it's such a mystery is because the problem is buried deep inside the inner ear. We're talking about the cochlea, this tiny, super complex, spiral-shaped part of your ear. It's almost impossible to get a good look at it in a living person because, well, it's encased in the densest bone in your body. The clues are literally locked away. So even though we often don't find a smoking gun, doctors do have a list of suspects. Think of it like a police lineup. It could be a viral infection, something as common as a cold sore virus that decides to wake up. Or it could be a problem with blood flow, or maybe a head injury. Sometimes it's even the body's own immune system going haywire and attacking the inner ear. The crazy thing is, the full list of possible causes is over 100 items long. Let's zoom in on just one of those suspects. A vascular issue. This image shows what a vasospasm is. Basically, a tiny little blood vessel deep in your inner ear just clamps shut. It constricts, cutting off all the blood and oxygen to the really delicate hair cells that allow you to hear. And when they're starved of oxygen, the damage can happen fast, and sometimes it's permanent. Okay, so if the why is such a mystery, how do doctors even figure out what's happening? Well, the good news is, even if they can't solve the why, there's a very clear process for cracking the case and getting an actual diagnosis. It all starts simply enough. First, a doctor just looks in your ear. They've got to rule out the obvious stuff, like a big chunk of earwax. Next up is the most important test, a hearing test called an audiogram. This creates a precise map of what you can and can't hear. And after that, if needed, there are even more advanced tests that can help them figure out if the problem is in the cochlea itself or in the nerve that sends sound signals to your brain. All right, we've arrived at what is, without a doubt, the most critical piece of this whole puzzle. Because once you have that diagnosis, a clock starts ticking. And I'm not being dramatic. It is literally a race against time. This timeline you see here, this is everything. All the research points to this. Treatment is most effective if you start it within the first 2 weeks. After that 2-week mark, the chances of a full recovery start to go down. It's what doctors call the critical window. Now, you might have heard that some people just get better on their own. And that's true. It's called spontaneous recovery. But here's the thing. There is no way to know if you're going to be one of those lucky people. It's a total gamble. And what we know for sure is that getting treatment early, usually with steroids, can seriously boost your odds of getting your hearing back. We're talking a significant improvement. It's about being proactive, not just crossing your fingers and hoping for the best. So look, the message here could not be clearer. Do not wait. Don't say, I'll see how it feels tomorrow. Don't brush it off. If you notice a sudden change in your hearing, you have to treat it like what it is, a medical emergency. Go see a doctor immediately. So I'll just leave you with this one question. Now that you know what's at stake, now that you know there's this critical 2-week window, if you woke up tomorrow and your hearing was suddenly gone, would you wait? Because what you decide in that moment could make all the difference in the world.